utilized to determine the effects of participation in social and sports activities with perceived well-being in terms of depression, anxiety, outward irritability, and inward irritability. Through random sampling, 50 patients were selected and randomized into two groups: an intervention group with social and sports activities, and a control group with standard intervention. The perceived well-being of patients obtained at baseline were compared with the results obtained 2 weeks after the intervention administration. Comparison of results from pre- and post-intervention in both experimental and controlled groups are as follows. Depression. Comparing the baseline scores of both intervention and controlled groups with depression, it was observed that the control group scores are higher as compared to the intervention. Comparing the post-intervention results of the controlled and intervention group, the control group's results seem to have worsened while those in the intervention group improved. For this test, the alpha was set at 0.05. Comparing with the p-value of pre-intervention, which is 0.77, it can be concluded that there was no difference between the two groups since the p-value is higher. Post-intervention, it is seen that the p-value, which is 0.02, is lower than the alpha that connotes a difference between the two groups. Anxiety. In terms of anxiety, it was observed that the control group scores are higher as compared to the intervention group. The control group results seem to have worsened while those in the intervention group improved, as evidenced by the significant increase in the post-intervention score. For this test, the alpha was set at 0.05, comparing with the p-value of pre-intervention, which is 0.70. It can be concluded that there was no difference between the two groups since the p-value was higher. Post-intervention, it is seen that the p-value, which is 0.03, is lower than the alpha that connotes a difference between the two groups. Outward irritability. With regards to the outward irritability of patients, the control group scores are lower than that of the intervention group. However, comparing the post-intervention results of the controlled and the intervention group, the intervention group's results seem to have significantly improved, while those in the control group worsened. For this test, the alpha was set at 0.05, comparing with the p-value of pre-intervention, which is 0.67. It can be concluded that there was no difference between the two groups since the p-value is higher. Post-intervention, it is seen that the p-value, which is 0.04, is lower than the alpha that connotes a difference between the two groups. Inward irritability. Lastly, comparing the baseline scores of both intervention and control groups with inward irritability, it was observed that the control group scores are lower than that of the intervention. However, comparing the post-intervention results of the controlled and intervention group, the intervention group's results seem to have significantly improved, while those in the control group worsened. For this test, the alpha was set at 0.05, comparing with the p-value of pre-intervention, which is 0.89. It can be concluded that there was no difference between the two groups since the p-value was higher. Post-intervention, it is seen that the p-value, which is 0.03, is lower than the alpha that connotes a difference between the two groups. In conclusion, the group with patients who were involved in social and sport activities exhibited better performance 2 weeks after the administration of intervention, as seen in significant or marked differences in scores at the baseline and post-intervention.
Created using Powtoon.